Dr. Gary here, double board certified facial plastic surgeon and a busy lip lift surgeon, so I wanted to share with you guys some of my impressions and thoughts from doing these surgeries like 3 to 7 times a week and give you a sense of what I've noticed, what I've observed over the course of the last year on how to potentially improve this surgery. And there'll also be a featured showcase of one of my patients who is willing to share her story with all of you.
I'm very happy. I was addicted to a filler, and now I don't think I need any filler anymore. I'm loving in my new lip.
So stay tuned till the end of this video and you'll see that journey of hers. So let's jump right into this. The first topic we're going to talk about is the idea of a deep plane approach to the lip lift. So what is a deep plane approach when it comes to lip lift surgery? Well, it's taking the depth of the incision all the way down to just over the muscle, the orbicularis oris, which is the muscle that is around the lip area. It kind of wraps around circumferentially, and the skin tends to be a bit thick in this area under the nose, and you can remove the skin just down underneath the outer surface, or you can go further deep beneath what's called the smaz layer and the fatty smaz, which is a continuation of the smaz of the face, the superficial musculoaponeurotic system. So you can go beyond the smaz and you can arrive to just the fascia, which is just the covering, the outer shell of that orbicularis muscle. Sometimes in certain parts you might go through that shell of fascia, sometimes you're right on top of the fascia. Either way, you're basically right on top of the orbicularis muscle, and that's what defines the deep plane in this region. Now with my technique, which is the Ella lift, and with most other high volume lip lift surgeons techniques these days in 2022, we're not going beyond the muscle. We're rarely manipulating the muscle because we know that manipulation of the muscle will cause potential irregularities with speech, the ability to eat properly, with the motion and the function of the upper lip. And it really doesn't help delay the potential drop that some people see with the lip over time, and it really doesn't create longer lasting results just because you've cut into the muscle. So we've been avoiding that, but we're trying to get to the deep plane, which is the layer right on top of that muscle. Now let's go into the second thing, which is nasal sill lowering. And I've mentioned this in prior talks, including in my 2021 update on the lip lift. But what I've been noticing is that in about 25% of my patients, as well as the patients of other high volume lip lift surgeons, if you look very closely at our before and afters, there can be a lowering at the nasal sill. So that's between the columella and the ala. Right in between that is what's called the nasal sill. It's almost this little mound. Some people don't have much of a nasal sill, other people have a very defined nasal sill. And there could be some lowering that occurs because you're removing the skin, you're then latching this remainder of skin onto the base of the nose, and with gravitational force you can get a little bit of lowering, and that will make the nostril appear a bit wider and longer from both the profile view and the frontal view. It almost never bothers patients in the post-operative period after several weeks have gone by and the swelling is reduced. In the early period when there's a lot of swelling, it could look a bit frightening and worrisome. Over time it does relax down and everything sort of looks just fairly normal. But if you're very attuned to that area and you're looking at your before and afters, it can appear that the sill has now been lowered. And that's just one of these ramifications of lip lift surgery, and something someone needs to accept and understand that that's a possibility if they're going through this lip lift surgery, and that's with even, in the best of hands. So what can protect against lowering of the nasal sill? Well, if the nasal sill is very robust and the mound there is very thick, and the tissues are thicker there, what I found is that resists the forces that bring it down. So that's one thing I look for to potentially predict if the patient is almost definitely going to get a lowering of the sill, or if there's a chance that they might not, but we can never fully predict that before the surgery. Number 3 is going to be deep suturing. Now, I always suture in multiple layers. There's a deep layer of sutures, and then there's a layer of sutures on the skin surface. As I've done more and more of these lip lifts, I've started to place my deep sutures at a deeper level, if that makes sense to you guys. Basically, you can put the deep sutures. Deep sutures are dissolvable sutures that help increase the strength of the wound. You can put those deep sutures just under the layer of skin, right at the, essentially right under, like at the surface, but like right under that epidermis. You can do that where you're grabbing a lot of the dermis and bringing everything together. But what I learned is that that brings a lot of additional tension onto the wound closure, and it basically takes the surface of the skin and wraps it in. So even when you're putting your superficial sutures on, there isn't that nice eversion that we need to get in order to arrive at a final wound that closes well and that heals well over time. So as I've done more and more of these surgeries, I've started to get better at placing the deep sutures at a deeper point in the layer of skin that we're working with. So now I place it more into the smaz layer, and I have that deeper layer holding the tension. So closer to the skin surface, there's less tension. So when I go and I put my skin sutures on, there's a nice eversion and there's a relaxed element to that type of skin surface, as opposed to that tightness that I used to get before. And that really has impacted very nicely on my lip lift results. So I think mastering the deep suturing and placing those deep sutures at an even deeper depth than what a lot of people do these days has helped my results, and I know the results of some of my colleagues as well. The next thing we're going to talk about is post-operative instructions. They're very important, and I always tell patients you must relax the lip area for 2 weeks, minimum 2 weeks after surgery, and that starts immediately after your surgery. So some patients like to giggle, some patients just like to laugh, or some of my patients do a lot of this type of movement, just reflexively. That's just the type of movement that they do, and all of that can impact negatively on the wound healing, because it's not like we're putting cement into this area after we're done with the surgery.
The concrete should be laid continuously to prevent formation of cold joints and irregular surfaces.
They're just sutures that can cause some degree of give if you are moving the area. So it's very important, and we stress this a lot, and the patients who listen to us do much better than those who don't. It's very important to just limit all the activity of the upper lip area for the 2 weeks after your surgery. So the ones who listen, we notice, get thinner, nicer looking scars than the ones who don't. So do your best in the post-operative period. The next item I would like to discuss is the upper tooth show. Now, a lot of patients want a lip lift because they find that when they open up their mouth or when they animate and talk, the upper teeth don't show much, and sometimes it's only the lower teeth that are showing, or the bottom teeth, and that isn't as youthful and as attractive generally as when the upper teeth are showing somewhat. So people want this surgery for that purpose sometimes, and sometimes that's the primary reason that they have in mind. But what sometimes happens is, as we lift the upper lip and we roll it out with the lip lift, the red portion of the lip can still hang over the teeth, and sometimes the upper teeth are so short that it's difficult to expose them completely, or at least partially, with the lip lift. So what I tell patients is that the upper tooth show is essentially a byproduct of the lip lift that's not completely guaranteed when you're going in for this surgery. So if that's the number one reason why you want a lip lift, you have to accept the reality that you might not get those teeth showing after surgery. Now, could you remove more and increase your chance of getting the teeth to show? Sometimes, but sometimes if you remove too much, then things start to look artificial and your overall facial proportions are off, and your upper lip to lower lip ratio might look unnatural. So it's not always worth doing a lip lift and removing so much just to get the upper teeth to show. So that's something I think important to point out to everyone. And then the next item I'd like to discuss is asymmetries. So patients frequently have facial asymmetries. We all have facial asymmetries, and we have a video that we made to talk about just this on Marcia and her facial asymmetries and how we all have the same thing. Lip asymmetries exist, and some of them can be corrected with a lip lift and some cannot. So the types of asymmetries that oftentimes we can improve on are the ones where the Cupid's bow has some irregularity in terms of the height. The height is mismatched from one side to the other. We can often line that up better with a lip lift. Now, certain other asymmetries of the lips really cannot be made better, and that includes when one side of the face pulls more than the other side. That's a muscular type of impact. Oftentimes one side of the face is just stronger than the other and it's pulling more, and so you can't adjust that with the lip lift surgery. Also, sometimes the lateral aspect of the lip is different in volume and in shape than the other side, and that you also really cannot fully adjust for with a lip lift. So I think it's important to realize which asymmetries of the lips can be improved on and corrected with a lip lift and which cannot. So I like to have that conversation with patients during the consultation to give them an honest sense of what we can achieve and what we probably cannot achieve with a lip lift. Alright, so now let's talk about the corner lip lift. I get asked about this often. Some people want to combine the lip lift procedure with the corner lip lift. My stance on this is the following. I think that it's better to stage the procedures, meaning to do the lip lift first and then potentially the corners. So I do think there are patients who from the beginning we kind of know based on their anatomy and based on the lateral aspect of their cutaneous portion of their lip folding in that they'll likely be decent corner lip lift candidates, but I don't like to always combine that together with the lip lift at the same time, and it's for two main reasons. One is that a lot of patients find that after you do the regular lip lift, the area looks fine, like you don't actually need that additional surgery. So that's the one reason why. And the second reason is that with the corners, the scarring is potentially more visible because it's directly on the vermilion border and it's more difficult to disguise. And so I find that it's better to do the regular lip lift, see if the healing is appropriate before subjecting someone to the corner. Because if the healing isn't great here, it becomes a lot more difficult to mask. And that is why my preference is to do a staged approach to the corner lip lift. Not everybody agrees with that, but that is the way that I've found works best in my practice and in my hands. Also, I have to mention that it's more difficult to predict how much to remove from the corners when you haven't yet done the lip lift. So once the lip lift is set and you're happy with the philtral distance, then it becomes a little bit more easy to judge how much of the corners need to be adjusted. So yet another reason. Now let's talk about revision lip lift surgery. Some patients get a lip lift and they feel that they want additional lifting, and that's, I would say, the most common reason for a revision lip lift, whether it's in my practice or the revisions that I do for people who've had surgery elsewhere. But sometimes we do revision lip lift surgery for scarring, and the scarring is suboptimal, and we decide that instead of laser resurfacing and instead of microneedling or other resurfacing modalities, it might be better to just cut out the scar and resuture. In those situations, especially if the scarring was quite hypertrophied, meaning there's a lot of scar tissue that formed for that patient and it was kind of heaped up, I will often not just do the excision of the scar, but I'll also inject steroids at the same time. Usually Kenalog 10 is my steroid of choice. So doing that type of injection at the time of the revision surgery, I found really helps improve the final healing results for those patients who happen to form a lot of scar tissue initially. and that can be a helpful adjunct as well. So there you have it. That's my lip lift update 2022, and with this next year we'll be doing even more lip lifts and observing more and reporting back to all of you about different advances and ways to improve this surgery. I'll also be shooting more of these surgeries in 4K. We have a new surgical camera that's coming, and that will be really cool to get very high def footage. Without further ado, as promised, here is the lip lift journey for one of my wonderful patients.
I had lip fillers for many years, and I just realized the last few months that when I open up my lips, it looks kind of funny, so it makes me addicted to get fillers. So now I don't want to be depend on the fillers anymore, and I found the Dr.Linkov Instagram, and I said to myself, this is what I want, and then I want to be natural lips without depending on fillers.
And then we dissolve the filler.
Dissolve the fillers,
yeah,
and
let's take a look. Lips together. Okay, I'm just gonna pan around here. Lips together. I'm back with my amazing patient who's now 1 week out from her lip lift surgery, and we'll show you how she looks. So here we go. You can see each of those little stitches along the base of the nose. That's what we're going to remove now. There's really not too much bruising, which is great. The swelling is also, fine. It looks okay. It's still going to be swollen, of course, for the next few weeks. I tell people up to about 3 months, but it really, after the first week, comes down quite a bit. How are you feeling?
Great, actually. Yeah. I didn't take any painkiller, to be honest. No.
Awesome.
Yeah. So I just put the antibiotic ointment.
Yeah.
Great. I get off the counter, and that's it.
That's excellent.
Yeah.
Okay, so now we'll remove the sutures. Hi, so we're now 2.5 months after an upper lip lift, and how do you feel?
Feeling great. So I was away in vacation, and I met some friends, and they told me, wow, you look prettier now. And I didn't tell them what procedure I had. This is the result beyond my expectation, actually.
And does it feel like normal, or able to speak normally? Are there any things that you feel like you can't pronounce, or it's all back to normal?
Yeah, back to normal.
Okay.
For the first 5 days, swollen, and I felt nervous a little bit, actually, because I never saw my lip that swollen. But after 10 days, I can see I was loving it. Yeah.
And then in terms of the scar area, does it, when you don't have makeup on, does it bother you at all? Or?
No, actually, I still have the cream on, but it's getting faded away.
And we didn't do any lasers or nothing like that. It was just the surgery. Okay, great.
Yeah.
Great, awesome. I'm just gonna zoom in here just to show how fabulous everything is looking. And yeah, it's healed really beautifully. And then mouth open for me. Great, you can see the teeth and everything. Great. Any words of advice or any wisdom you want to share? Because a lot of people are thinking about the surgery, but they're nervous, and they maybe are holding on to the fillers because they don't know if it's like safe or
I had a lot of procedures done with other surgeons too, and to be honest, Dr.Linkov you're in the position number 1 now for the surgeons I've ever met, because you took your time. And the procedures I had, we spent like 3.5 hours, I think, and just for lips. I didn't expect that. I thought it was an hour procedure.
We don't like to rush here.
Yeah.
And the surgery itself is quicker, but it's a lot of time we spend here in the office.
So I feel very comfortable, and I'm very happy. I was addicted to a filler, and now I don't think I need any filler. I'm loving it my new lips.